purposes, if you want to even do a private university, you want to do private universities that are recognized. Like, some people do courses at Central University, Valley View, Ghana, Garden City University, Calais. I know people have gone to other private universities, and then still their certificates have been recognized wherever in the world they find themselves. Of course, there are certain private universities who are affiliated to public universities, and those people have also. I wouldn't totally say don't go to a private university, but what I want to say is go back to private university and make sure you've done your necessary investigations to make sure that these schools are accredited to run the courses they are running. Make sure that these schools are supposedly affiliated to the right university. So most of the university, private university, or you're affiliated to Gardens, or you're affiliated to a Tech, or you're affiliated to a Legon, or you're affiliated to a UCC. Making sure that all this, necessary investigations now was why? So that you don't go and throw your money away in a program and home bound fast one thing. But at least for the public universities, say they are internationally accepted, they are nationally accredited, they are approved and all that. They are not risk no form. But private universities na e be one my risk bemu kakra because we program maybe it's not really recognized. And that is what I want people to take it upon themselves to do the necessary investigations to make sure they are getting to the right private universities if that is the only option they have and they have to do it. And then there are some of them like I'm making AJ like this. I know she went to Valley View and she's in the US practicing. It means she went through the process of verifying the results. Everything went through smoothly. And that's why she's been able to practice here. I know people that have gone to central universities are practicing elsewhere. I know people that have gone through Garden City, they did their bachelor's. Although no my basis for baby, but basic diploma no baby, but degree or Garden City. And because I know Garden City is affiliated to Tech, they are recognized. So always take it upon yourself. Say, I want to go to this private university. The person may call Wisconsin. The person may call her. The person may call her. Are they accredited? Who are they accredited to? Are they on their own? If they are on their own, are they accredited? If they are not on their own, which universities are they affiliated to? Because the thing about affiliation is who we are now we hear transcript we are normally affiliated to Legon. Legon, they transcript never mouth. So there will be some aspect of Legon in your certificates that would make it somehow recognized wherever you find yourself. But ideally, public universities, because the risk is too low. Ideally, public universities. If you have to do private universities, make sure you have done the necessary lay down investigations. And after the Abu Bobo Suibino, now recognized and you use them. Meaning say bank which might throw more light on it.
Ready to ask mommy why now? May you share maybe.
Okay. So I don't AJ, are you there? AJ Ohonomana. Akocha Papa, you can come in.
I'm here.
So AJ, the question is about private universities or public universities. So I don't know whether were you listening to my explanation, Amedema,
No. Can you please go back? Sorry.
Okay, so what I'm saying is that public universities they are accredited, they are approved, they are internationally recognized. So
yes,
that is the ideal thing. Now, if you have to do private universities, it's not bad, but you have to take it upon yourself to do the necessary investigations also here, because not all private universities are yet recognized. There are some of them that are internationally accepted, Valley View, Garden City, Central University. And move in your programmer, it is fine. If you are Ghana and say they are Nabita, set up some of the private nursing training schools, they are even posted by Ghana Health Service. They are accepted. Make sure say one a program, no, take it upon yourself to find out say private university now are they properly affiliated to a university and now say are they properly accredited? Because in Ghana, it's two things. Either you have your own accreditation or you are affiliated to an accredited university.
Right, yes.
So the individual, should take it upon yourself to find out. Because at the end of the day, we see can already go to your fees. And private universities cost a lot. And you got two sick at the end of the day, you realize one program in a recognized place, and then you would have wasted your money for nothing. Maybe a baby in a job posting a bad problem. Now using it outside the country, so about a problem. So take it upon yourself to do that necessary investigations. And I say, follow the basics now. I can be no. And then I think it should be fine. The age I want to make see and the other account now the account.
Okay, so I agree with what Freddie is saying. You have to do your due diligence. I attended Valley View University, and Valley View has their own accreditation. So we are not affiliated to any university. So yeah, it was like straight accreditation from Valley View. But when I was in school, so because it was a private university, we had lots of Nigerians in our school. And most of them were telling me that Ubeko school in Nigeria, like 4 years, Ubabe say accreditation. So it means you wasted your 4 years paying school fees, studying for nothing. So you have to do your due diligence, and also making sure well, when I was in school, we heard that the government wasn't posting, degree nurses. But I think we balloted or did some, like we had to write memos to the government, and they accepted to post us. So, in a nutshell, if you want to do a private university, because it's expensive. So if you want to do a private university and do your degree straight, do your due diligence, find out if the schools are accredited or not, and also find if the government is going to post you as well, because you need to work and you need to be paid as well. So yeah, I also said basically that's Freddie already said everything, so that's
okay. So
I can add on it.
AJ, let me just put you on the spot here. You went through Valley View, you went to a private university.
Mm-hmm.
You've already explained to us say you had to. It means the government posted you.
Yes.
And that was years ago. So now I'm sure say it's smooth sailing now for people that complete.
Right.
Valley View. Are you reliably informed? Say people that complete universities like private Valley View, they get easily posted with the government and
well, during my time we were posted, but I can't say for the people after me. Yeah, I can't say for now. So I think I'll just have to ask and find out.
Okay, so that's what I'm saying. Say the honest falls on one program.
Yes, yeah.
Find out are people being posted after going to do their courses here? Does the government accept them into the fold no more or more post them after school now? Okay, so that is in Ghana. Now, AJ, let me go outside Ghana. We all know you are a nurse in New York. It means you went through a process of evaluation with your home country, your license, your training from Valley View.
Right,
and
yes.
Sana, a New York nursing board, Emma, a chance to write the English. Some people feel say, oh, private university, I have the minimum legal on it, technique, UCC. What can you say about it? Evaluation process, being accepted by the board and all of that. How can you tell us a bit about the whole process before you got your license?
So when I was doing my evaluation, I just had to do I went with the New York board process. So I didn't do CGFNS. I did I downloaded some forms, sent one to my school and sent some to NMC. So my school, I had to fill my parts. That was like my name, date of entry and date of completion and all that stuff. And then the school had to complete to make sure that I indeed, I was once a student of Valley View and I went through the 4 years of education. And then added my transcripts as well. So I think for the evaluation, what they are trying to figure out is the courses you did during your 4 year or your entire study, does it compare to the standard in the US? So that's what they are trying to find out to see, say, courses now, like, is it the same for general nursing in the US? Does it compare? And is it transferable? So you just have so Obeko Private University, you have to make sure, say, the courses you are doing tally with like the American standard or whichever country, UK or America standard. And I think with that it's very easy. So it was a very easy process for me. It took me almost a year to get it done because it was post-COVID and they had like a lot of back data they had to clear. So it was, but now for my colleagues I've done it takes like 3 months and then they get the verification. So the verification was a very easy process because my transcripts and my courses I did when I was in school is comparable to that of the US. So yeah, that's what I can say. Freddie, are you here?
So if I understand you clearly, what it means is that once you trained and then they check your credit hours, and you could vis-a-vis it with the American system. It was no problem at all.
Yes. So you see,
Yeah.
with the case of the midwives, right? Some of the who's a midwifery in Ghana, no, they go the direct route. So they really do not do enough credit hours as the general nurses because there's more focus on the midwifery part. So that is why it's not comparable in the US. Because in the US, the basic is you being a nurse, and then if you work in you can work in LND, you can work in all other areas of nursing until you want to go do a master's in midwifery, a master's in FNP, a master's in whatever you want to do. So with the midwives, they don't have enough credit hours to account for or to compare to that of the nurses here. That's why it's not accepted in some parts of the US. So
Yeah.
if your credit hours and then the courses you do match the standard here, it's very easy for you to get verified.
See, as we go on, no, I'm saying you better delve in more into why we were saying general nursing. I'm saying AJ threw a bit of light onto it, but as we go on, we'll delve more into it, and then people will appreciate why we are saying that, especially if you have plans of wanting to travel there. But like AJ has rightly said, irrespective of say call private university or call public university, no, the most important thing is the credit hours are where for those programs. So, for example, anatomy and physiology (AMP), we have how many credit hours on it? What you see, in total, anatomy 1, anatomy 2, anatomy 3. It be 3 credit hours, 9 credit hours. It be in the US system, no. Here anatomy and physiology, how many credit hours? Oh, you hear 7. Oh, crowd, oh, 9. You know, they can compare comparable. What you say? But ebi anipa no ko midwifery. We anatomy 1, ebi wanya anatomy bio. And ebi anatomy 1 and 2 no. Wanya anatomy bi ebi also was 2 credit hours. Into 4 credit hours of anatomy pay. Who the by US or we here 7 credit hours for anatomy and physiology. Into credit hours in ebi match here. So those are the little things go against certain courses when you want to travel with it. For example, maybe in here geriatric, in here gerontology. We are midwife. By virtue of your course as a midwife, into one year gerontology as part of your program. And our way psychiatry, 1 year gerontology. Meanwhile, in the US educational system now, they need that to be part of your credit hours and some me assign to go and write the NCLEX. So those are the little things we'll come in later to talk about it. But like AJ has rightly said, irrespective of where once it's coming from an accredited university or a university that is properly affiliated to a public university and an accredited.
Hi, Freddie.
Freddie, call my back.
Okay. So we were talking about so he was asking me about general nursing, and since I went to a private university, he wanted to find out how my verification process was because I went to a private university, and people say Okwa private university it's hard for you to be verified in the states or whichever country you are going to.
Yeah, a lot of people feel that if you go to private university, the only universities that are recognized is the Legons and the Tech, and that's it.
Right.
Yeah.
So the truth of the matter is, for the government universities, it's very difficult for you to get into the nursing program,
Yes.
especially if you didn't do any other course like science or science, but or grades is not as good. So private universities would be your last resort.
Okay.
And I can attest, I went to Valley View. It was a very good school. As an Adventist school, people talk about like we have strict like rules like dressing and food and all of that. But I mean, you are going for education. You're in school only 4 months, and you are back home, and then you're back to school again. So I didn't see the issue. And I mean, 4 years comes by quickly, and I'm done, and I can wear whatever I want to wear. So if you are thinking of say, oh, your freedom and or think of the bigger picture, you're there to get an education, and let's talk about life. So get what you're gonna do, like get it done, and then get it out of the way. And for me, most of our you know, now the world is evolving. Still, a master's degree, because you know, the more people are doing this, the less you know, the less applause is being given. So you see, a master's so bachelor's is like the basic degree you can get. So if it's possible for you to get your degree straight out, I would say do it. But I mean, in terms of finances, if you're not able to, you can resort to nursing training, but please do general nursing because general nursing in the US is like the basic. I'm not even going to lie. A friend of mine is a midwife. She came to the US and she's in school doing her BSN in nursing. Why a midwife? Why a Juma? She's had like she worked for 3 years in Ghana, and now she's doing her BSN. Babucha, if you want to be a midwife, you do your general nursing, you come abroad, you can work wherever you want to work. You can work in labor and delivery, dermatology, wherever you want to work. And if you feel like you want to advance or go further, you can just do your master's in midwifery. But general nursing in the US is like the basic of the basic. You have to be a nurse to work in LN. You have to be a nurse first. You don't go straight into specialization. So you have to be a nurse first. So general nursing is the way to go. And I mean, from the live, you can attest the fact. You can also ask people who did other specializations like mental health and midwifery and how far it's gotten them. So if you do have the choice to make, yeah, choose general nursing.
Okay. Thank you, Reggie. Agusia Papabi. Agusia Papabi. Agusia Papabi, tell us, what school did you attend?
Okay, so I attended a Japan Midwifery and Nursing Training College
Say again.
in the Upper West Region.
Oh,
Japa.
Jarapa. Okay.
Yeah,
All right. So I know you did midwifery. As for me, I know your story. So
yeah.
I'll put you here for now because I want you to share some of the challenges you faced.
Okay.
You have come out successfully, but I know it wasn't as easy as we thought. Hey, Freddie, girl, Ben, how
And now me guess me and we have new Michelle.
One wow. Me say, oh, Freddie, oh, no
Me
comment.
baby, me baby girls me and no na.
Anyway, so myself, I also made me call nursing training, all right, but then I did my BSc in Central University. So I would say that if you are considering, like all of them have said, you're considering the private universities, choose the ones that are accredited. Initially, Central University was affiliated to Legon. Then they got their own accreditation and they are on their own. So one of the schools that you can also consider is to because I have used it for the process and it went through smoothly. So in case you are thinking of which university is accredited, the only thing is that private universities are a bit expensive. And for that reason, if you are choosing them, you have to have the financial muscles. But apart from that, I think they all serve the same purpose. They do same courses. All right, they do same courses, right? And I'm what? AJ,
Same
They do
process how?
they do basic international standard courses. I
yes, they
accepted
do
in
same
Ghana,
courses
so
with the Legons and the techs in the nursing.
Yes.
they take their curriculum from them, you know.
Yes, so the curriculum are basically the same from same people. So, um,
And
oh, okay, okay.
it's not true. Say Omunim Legon, Omunim Central University.
They do know.
They don't care about that. They only care about say university need what accreditation. That is what your evaluation board will do. They will see say school now program. Do they have accreditation with the government
That's all they
do
need.
that program? And then they will also look at your credit hours in the individual courses
Yes.
and compare it say meet American standards. Nah. I don't know. See, I started discussing topic why we should do general nursing.
Let's go. Let's start because when we present main continue. Let's start. Okay,
Okay.
Central also was accredited to take. All right.
Okay.
Hey, you person tena house. Who say me handkerchief that me call?
Yeah, full.
Off why? So please, Fred, let's dive into it. Let's dive into it, baby. Let's
Okay.
go.
So the question has always been said, maybe I've gotten the grades that I need to do. So our grades na many no. Mitimi de kwaye community. Mitimi de kwaye general nursing. Mitimi de kwaye psychiatry. Mitimi de kwaye midwifery. What do I do? What is the decision for me to do? Some people might tell you, so we are midwife, our salary is 10% more than general nurse. That's a normal credit. It's the biggest lie in the 21st century. And you know, credit. Say, and I know credit, I mean, it's never true. It's a midwife salary. I was a GRNA chairman for about 8 years. You know, I was privy to amount for pay slips and salary levels and all that. Near those discussions. And yet, I don't think say baby crat is our and a baby crat is our I don't think say there's so much of a difference that should inform your decision. In this can be I mean that's what this difference is crowd. So I know people that took the decision to do midwifery because of feel say oba be sika more or more salary than RN.
This is Freddie Asem with Rom was array.
Oh,
Yeah,
that's almost
general
yeah.
nursing. Almost
Almost
some business
yeah.
catching.
It's almost serious. So, and you know, intro. One of the biggest lie of the 21st century, no. Inti, a more being fast, I didn't even that down. Midwifery. Midwifery is not bad. Like I'm saying, midwifery is not a bad cause. It's a specialty in Ghana. Now, let me go back to the history of midwifery, Kakra. When midwifery started in Ghana, it used to be a top up to nursing. It used to be a specialty of nursing. So, what I'm just trying to say is that to become a midwife, you first should have been a nurse that is licensed that why you for some years and then a top up program to become a midwife. Now, why did we bridge as Ghana to be doing straight midwifery? I think somewhere in 2005 or so, or now sometime before that time, now there were shortage of midwives. Now the government has to put a system in place, a bed bridges gap, no, and that is why they started straight midwifery. I'm privy to the midwifery curriculum, Kaka. They do first 1.5 years general nursing before or last 1.5 years you transition to do midwifery proper. Midwifery and narrow midwifery yeah, and yeah, bibia kuntambia yeah. A labor ni antenatal period ni post. Some little bit of specialty there. No one in itself no is not complete without nursing, and that is why in order to start midwifery, you do nursing before you later on. I mean, in your final 1.5 year or 2 years and now 1 year, no, you zoom in to do your midwifery. It's the same thing for all specialties. Normally, Ghana straight, you know. Psychiatry being one of them, community health nursing being one of them. They are all formed on the basis of nursing. Why am I bringing this argument in? Meka kwa kusi say, we are simu baby. Now most of the countries now, MBCJ say you see yourself there in the next 10 or 15 years and now 5 years. No, all those countries are still practicing that practice. No, where you have to become a nurse before you go and do midwifery. And let me use Barbados for example. I passed through Barbados before coming to the US. On where Barbados recruitment, they didn't pick any midwife. Recruitment opportunities now about Ghana Health Service. About 3 different batches. Midwife need back me to Barbados. Why are they saying so? Because in their country, their midwives are nurse midwives. They are nurses that have gone to do top-up programs. It's a midwifery. 3 years now, a straight midwife man. No, the core country be one. Midwifery now, countries baby country be anyone. Most of the countries will call midwifery near degree level. Master's level programs. Into who offer with diploma midwifery now Ghana and sell the Bible cheap crowd and why remukra. Unless sometimes nan saying that I stand to be correct, certain countries like UK, Emma Quine for midwife to transition, but no crying 50-50. And it's kind of smoother for degree midwives. No, now US will be 3 or 4 state boards. Currently, we have Arizona, Washington, New Mexico, and some Texas. So we degree and sometimes we more allow you to transition. But no, more allow you to transition your midwifery. Say you are not transitioning to come in as a midwife. You are transitioning to come in as a general nurse. So in a way, they are just considering your course you did as some aspect of nursing, and then if you can prove maybe a gerontology and certain things, and our school need to meet the transcript council, yeah, gerontology, and maybe I could create a degree that gives you certain other credit hours, and then they can accept you to come and practice nursing. So, with the exception of maybe a UK, that sometimes midwife team practice direct midwifery, which is a recent development, and yeah, easy to transition midwifery in Ghana, more so diploma in Ghana to a different country.
And look,
So,
I know nowadays UK is not easy. Some
so
of them
nowadays,
have passed the exams and they are not getting the job as midwife.
they're not getting a job as
They're not
midwife
getting
because
the job.
at the end of the day, midwifery on only basic level for entry for general nursing require degree. And then obi yɛ kakra akɔ akɔyɛ midwifery abɛyɛ nurse midwife. Also wɔ diploma in midwifery wɔ Ghana. Wopɛ sɛ wode ba aburokyi bɛyɛ midwife. Na abɛgye wɔn awo. Wɔn aba broni ba awo. Eti no yes accept wa. Ebi a yɛ consider the fact sɛ wɔ nursing bag and nka midwifery to come and practice nursing, and akosua papa bi you were a midwife in Ghana before you came. What your NCLEX? What pass it? I'm putting you on the spot. O license now, is it license that will permit you to practice midwifery?
No.
Aha. So that means that no direct NS no.
Yeah.
Aha. So that means that akoso papa bi unya and anka who take decision be all free Ghana. Considering stress, I'll pass it to anka befa midwifery and befa nursing.
Oh, and I make us say, come for nursing. Now me, you know, me nursing, me ankasa midwifery no. Back before some me start school, I didn't even know say like now young people are nursing. Actually,
Oh,
me
okay.
meta forms me to call nursing training. By drop and so time I feel almost starting midwifery. So I was the third batch. It's not auto Catholic schools now. They send you like they handpick some people and send them to like yeah, other Catholic schools. You know. So
Ah,
that's how
okay.
mine did. Into me, I midwifery did me. I know any my dream say I didn't even
Obey.
know say young as a young person right from SS makes me a midwifery. Nti
Okay.
ɛyɛ nkɔkɔɔfoɔ holy family for na ɛde me kɔɔ
Because
drapa
of
hɔ
Jerapa na Catholic
midwifery no
University no.
and people
Omukaze.
didn't know that nti na nkɔfoɔ nso nkɔ ɛhɔ no so that's what they
No.
were doing wotɔ afidie
Yɛbɛ
anyway
wɔ
yeah they
admission
send
biara
you
ne
there
yɛde wobɛkɔ Jirapa.
yeah
Ɛbɛwo paa na wohwɛ. Okay.
yes nti me ankasa
Okay.
the midwifery na ankasa na ɛnyɛ me a me choice like ɛnyɛ me a me pɛ sɛ bɛyɛ midwifery from the start ɛna me san baa ha nti me a me bɛduru ha no nyinaa ɛna meka sɛ I didn't even know Mati the muken na minim say midwife they won't mean practice wa and when I came my friends are no more harder than so I can the same thing. It means 6 years ago minimum I think my end I didn't even know I could even like practice as a nurse cry. Name do you know nurse cry me nim say come to me train test ne cry. Until
So,
recently yeah and son me that's why Debbie, I make say I wish like I had all this information like once I broke out the obese and the obese so no on the route so fine and no I be now so be
wobɛfa
ti
nti
wunni obi a ha wunni obi a ono no the
ɔyera ho
nursing
nyinaa
ba ya
mbɛyera.
na say we ya obebra ansa na wahu part
Wakoto uremu
so
amufi amunko uremu.
yeah,
Aha.
it's good. There be make us initiative when the pa people are like depend be near be. To me buy and then go for case. We a midwife I won't win away. And I started telling my friends back home says some feda they should do it in nursing, like they should further in nursing, they should further in nursing. Na minya kura ehun say enkles be anyway crowd. But I started telling them say like oh my diploma all right, but chance by some better as well they should um um do the degree in nursing, they shouldn't like go and do midwifery again because I have no midwifery no more bad. They are not going to be able to use it and answer the visa. You
And
know, it's good. A good there. RN Gloria anyway. You know, why I think I will be money there. Nay, any come. But if you have the chance and you have the grace to do it, I think that minimum award na pay agia that be able to do her you can still fed up and do it.
and 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 then I want to talk a bit about how the US specialty system ne working.
Okay.
So what your NCLEX what a midwife? Because before I say on pass NCLEX no Unim deceleration, acceleration.
Yeah.
Yes, before passing NCLEX, how am structure NCLEX nursing structure net no. You are more than a midwife, excuse me to say in Ghana. Niama would maybe all the basic midwife or Ghana. Jina ono ma ebia theoretically won't mean stand up. Psychiatry niama ebia personally wouldn't worsen because of NCLEX no. Ebia all the psychiatry somebody who did psychiatry in Ghana. Diploma and a degree jina ono ma
Everything is into details, like.
pound for pound won't mean face you, baby. Why am I saying so? The US structure is structured in such a way, say, as an RN, you can work everywhere you want. Oh, yeah, RN now, person will come out. You just have to let your supervisor know, or manager know, say, oh, interest in midwifery. And then they will put you there as an RN who is working in minim sa almost minim the the firms the betting center but with different departments they bring, but
Yeah,
they will
labor
put
and
you
delivery.
labor and they will put you at a center that would give you that experience, and then as after you've worked there for a while no, they have certain courses and certifications that you may need to get in order to what to practice there. But at that time now you are still there and practicing and learning and going through the processes. You are doing things that are supervised and all that. But eventually, that is the pathway out me fast. So how you don't need to be an emergency nurse to work in the EC and IED. We are RN now we interest in emergency. You can let them know say we interest in emergency. Wherever they put you, they train you. So person will be emergency nurse. US that year, and yes, I knew that was a emergency nurse in Ghana, which is it's not wrong there, but I'm just trying to say, general nurse now, NASA also, but me, I wasn't a critical care nurse, but I work in a telemetry unit. I was a general nurse. I had my degree in general nursing, but I had interest in it. They will give you and they will train you for it. That is how our health system here. So don't be forced to do certain specialties now while we're there. Over Ghana, because the basis is always very important. Minimum comfort, what do we call it? Anesthesia. A chain I went to buy anesthesia na went to na yedin. Odwane call back in the nursing, basic nursing,
Yes. Yes, that's right, Freddie. What you're saying is very true.
Mene deputy chief anesthetist back on a call Barbados. Or general nurse. Because the CCK obenya as nursing or Barbados, and then the deputy chief now we Ghana no. A webra. A opposite in opposite action and reaction are opposite in the direction even no. So it's very important, say, that's why I tell people, say, at the basic level, no, get that general nursing in place. Say that actually would diverted crana so cool, say, oh, me quina me fire, me and me can you, me sound so bois, you can always come back to your roots and then make advancement wherever you find yourself. And much as other specialities, yeah, good, no. It's not applicable here. We are emergency nurse for Ghana. Over US, I only emergency nurse. We are critical care nurse for Ghana. Now I call critical care nursing school or Kulibu. Now the bag Ghana, you are not a critical care nurse. You are an RN who is working at a critical nursing department. That doesn't make you a critical care nurse. Critical care nurses, they're going to do courses that are certified here. So every RN can be an RN working in a specialty unit. Don't limit yourself. I know people would oppose the American.
No, nobody is opposing because
What I would say is
Ukraine now
I can't operative no. And degree nursing. Say be a diploma now person feda na emergency abeda ho. And be a legal straight degree. I would rather you go and do that straight degree than go and do emergency. I know most of my emergency nurses and critical care nurses will argue with me. My argument is so simple. Major evaluation with CGFNS, no. They took my legal degree, and said, say, comparable to the US standard. and gave me accreditation. Currently, I get paid as a BSN with a BSN nursing allowance on my pay stub. Meanwhile, me colleagues are emergency nursing or buy not to emergency ED or Juma, and so your first level RN. Or an evaluation. What the board told him was that Omuni equivalent of that program no in the US. It's comparable. And you know the only reason we are going to be right the NCLEX is because of what diploma in what in general nursing. Because the diploma general nursing about you, not the emergency no the in charge of Ghana and you know the Bible. So at the end of the day, you know, you both went to spend 3 years to do a program. Maybe they may BSN about me a BSN. Also do emergency by your first level RN. In order to be recognized as a BSN here, you have to do another BSN program here. In order to be, I know it's a very
obviously, please we beg.
a difficult area and I made that because I know me won't go for me blow my specialty and they will oppose to as I'm making. I know public health nurse, me lady friend beer. I have an evaluation report on my phone right now. Oh yeah, one any public health no any or kolebu public health. But I can't any never kolebu public health any kolebu. I must say there is no equivalent in the one and the first level RN now. Or use you and I know another critical care nurse that had to use the first level RN. I'm telling you factuals on the ground. So at the end of the day, you come in and you are an RN, but you are not a BSN, you are not a degree holder. We degree now here or Ghana and come baby a Ghana pay. And that is why I tell people say according to is the goal. Me, I had a chance to go and do emergency 2 consecutive times with Ghana Health Service Manco. I went for self-sponsorship and I call me straight degree because of I always had in my mind say me person be 2 coin. And Obi can say me I make you know. HM say all those essentially emergency in critical care they are easy, but to say ENT ne ophthalmic ne say am no e ho akwantu ye din tu. Now only ba
me who because I say that I'm not saying something for
why asumu na aba be na why any aha no kra ophthalmic nurse square ni ophthalmologist. And you know who ophthalmic nurse will have a degree holder ophthalmic nurse will have. I had to be an ophthalmic nurse, probably be a ENT special, a master's level program. Unless I stand to be corrected here, but to the best of my knowledge, this is what I think. So I always tell people, say, get the basics, do the basic stuff. It is accepted in the UK, it's accepted in the US, Canada, Barbados, wherever you find yourself. That should be, say, aha, na me pese me ye emergency, me ye. Because I didn't say me kwaya ba maybe the boss or the department, aha. I na me person me critical care nurse na me wa ha but I Ghana critical care nursing. So that is my opinion about that. I'll let people come in.
Can I say something?
AJ say something. Hello? Freddie, the way Freddie is bashing people there. Freddie,
I agree with him. You see, the thing is, he's actually telling the matter at hand. No. You think say he's being aggressive or too serious, but that's the matter on the ground. People don't like the truth. Nipano is a lived experience into your car. You should take note. So one of my aunties, right?
Here, or your critical care nurse, or your critical care nurse or US, or your first level RN. That's the fact.
One of my aunties,
or your critical care nurse or US, or your first level RN.
Me auntie back home, no ejima kolebu. She was almost at DDNS, Emna Ojaiba, America's nurse. She was a peri-op nurse, but actually where she works now, she's also like a BSN RN saying in she works in dialysis. Only me a theater because it's too fast paced. It's so serious. So she's working as an RN and she's dialysis no because it's too much for her. So what he's saying is true. Oh, no matter school could be even sometimes even Ghana, even masters in nursing now Ghana 1 year. Over US you can't compare it because masters here is 2 years. So it's not even comparable here. So it's like your nursing degree is what will bring you here. Then you can top up. But now Ghana as critical care nurse, ophthalmology nurse, dental nurse, those things, it's not applicable here. It's not going to work here. You're still going to work as an RN in either way.
So I can make will be reports. Obi
Hey, Freddie,
CGFNS report.
yeah, Yamima, but
No, match bro for CGFNS for the catch. On the catch also my evaluator your credit. No, my catch also any comparable in the US before we used to know. I mean,
Freddie, yeah, but my yeah.
When you told boy, asem banyan to was here, why? Hi, international nurse. How are you?
But that
I'm
was your
good.
committee. One that was committee.
Yes, the way Freddie are charging no. Freddie say
International nurse,
I'm
congrats.
Ghana
Oh.
no. Obi the
Ah,
critical care nurse in
eh,
literature we ni so we.
thank you,
No,
thank
that
you,
you
thank
like
you.
Kimmy.
Yeah,
The part of
the college in Semni Akogo. Yeah, I mean,
Yeah, then
it was,
congratulations.
Congrats.
thank
congrats.
you.
Freddie, I'm say Freddie wa Ghana no. Now Obi a critical care nurse na.
No,
Sister,
no.
that's
Say
some way,
Freddie e bi abre no.
Freddie, mami kebi ma, mami kebi ma Freddie. Chese, they made it look like so one koye ENT, one koye critical care, one koye anesthesia, and I say one nurse. Just say, like, I don't know, it
Demigod.
got
Pressure.
to a time, nurse be critical care nursing. And I'm like, well, me the many and show home because I knew where my target was. You know,
The
match.
Mrs. Ajima say a CGFN is way Chabiama no more trust and not comparable.
Oh, you are.
Recommend a school for you. So yes, school krako.
You know, that's the thing because me say no, send your Freddie Cano. That's what they told me. They told me say it's equivalent. Me quite I'm say it's equivalent to BSN in America. And I'm saying
I'm
yeah,
the idea. Maybe RN to almost say a equivalent to
yes.
me a diploma and I'm a degree. The
Uh-huh.
report now say a equivalent to RN to BSM program in the United
Exactly.
States. There is the same thing like Obi a diploma associate degree now
Uh-huh.
after a while
Yes. Inti
degree.
major money say no year me BSN.
And who hear me?
Me as a new grad, like first level, no.
Maybe Omoya was a BSN. That is how they
BSN
grade you.
straight, yeah.
Open me license with the border. University crowd me university me BSc crowd actually because of the fact some recognize it. What
Exactly.
did they make an as
Exactly.
so a bitter truth. Them say young crop only be emergency critical care perioperative. You can't a rare area.
Yeah, no dear, almost the be what Ghana ho, ba no be try NCLEX
Oh
no.
yeah yeah took my Bible chain there because yeah didn't to moon kase. Yeah the diploma na juma
Debbie.
yɛbɛko wɔ ha yi ya because obi dwen sɛ wobu ebi a perioperative animtia na wobu critical care
Ye mbu
animtia
omenimtia, but
mbu
that
ɔmo
time
animtia
now mreso ye no that ama ye nya so. Yen so ye mo nya so.
Hey, yes, Remo. Yes,
and glory the other thing is that yes of course those specialties yɛnka sɛ nyɛ o emu betumi aba mfa so because at the end of the day you can be working in those specialty areas. For example,
And
me,
you
me,
know
my friend that
things.
was a
Yeah.
perioperative nurse, or yeah, with interventional radiology, or yeah, as a perioperative, but you are an RN, you are not work, you are not earning the money that you should be earning. Meaning what the American as here. So if that accreditation is given to you, there is a money that comes with it. So the way my ENT department as a nurse, they amount the basic 50 something here, they will be any bina. Because more ENT trained nurses, here, more 90 something. So it means you are not there working as a just you are in that specialty, but you're not there because of that certification. You are there because you are an RN and I pay your experience the internet. You're associated with that department. No, I don't mean it personal, but I just want to advise the next
No, but
generation as
it
to
is what it is. We to me polish no to me nyane
because
sanity.
wako school will be our critical care when
Yeah.
they in charge 5 years.
I
Freddie,
say
girl,
by
the
say
critical care for.
just say in
No,
charge no na edimenti asien. I can't understand.
Oh, but Barbados there was good because Barbados I know say they accepted specialties. In Barbados, the people that were critical care and all those that they were able to get critical care department. But at the end of the day, in your core and salary scale in your critical care in India, salary scale in a number of years of service.
Oh.
Into a critical care no be a general nurse now I hear Juma 20 years now why Juma 4 years. I mean those things doesn't come in.
Paper Mucha, on this note, please power tap and share the live to someone to come and join the discussion
And
because A
And
lot
me,
of people
Anna,
are saying in the comment section that they wish they knew all of this information earlier. They would have made better choices. So what I say.
well, because
Right.
glory on, I say why a critical care 3 years for Ghana. I have one juma with all the experience. Why you want to book critical? Now if you want to China, Brunei say o certificate ni hunim faso.
Oh, Freddie, it may say name fast war. I know the A1 fast war, but it's just that you can't
So
be a
I
critical
think,
care
sir,
nurse.
Freddie, they are all kind of no cry. When we are discussing the thing.
International nurse if we hear.
But him sister, near Aya Mayana say it all boils down to yen penny for na edi any more Ghana no. They should stop fighting about the belt. Nini manona omonsha how we can compete and bridge this gap because it's a ho wahoo. And no necessary yes share because sa then the old Ghana now nim so betu kwan de any da men ko school ba wa be ko school.
And glory on the Ghana educational system next year a bit
Yeah,
mislead you because
exactly.
the Ghana educational health service is structured in such any ministry of health is structured in such a way say they need nurses that will run the system for them. In our gap in ENT nurses are the list of openings are steady leave approvals or by no here ENT for me and we hear critical care nurse 9 we hear emergency nurses 4 degree nurses 1 and 2 pay because him say we degree nursing but we need diploma ni no difference in share any mu tell me bro me ba go na specialty. So they corner us to do courses that will help us remain in Ghana health service. But say ube to kwanya, those courses wouldn't really benefit you. It is acquaint you. That's why I keep on saying, my argument that me now is not for the average person. No. My argument in now says acquaint you is the goal for you, dear. Then no sir, decision be I will take, ask yourself, say, how would this benefit me in the next 5 or 10 years time? And at the next, now say,
According to a new way, so dear, and yeah,
But
critical
even that,
fairness.
yes, Remo, even that, you don't know when your mind will change that. And not there. Me now for 4 years to come and quarantine. Me so acquaint to have a minute. Then because of some courses you did, you are not able
me
to.
say, Glory, the every time cry your mom kwe piero. Tap piero. Physician assistants or a nurse, no what diabetic kwe pie. Ni adina kwe inti, adina ko di doctor we actually so actually ho baby doctor kitu we ba na afi amana useless.
Anyways,
Yeah,
back to the topic.
mami intra so.
Why are they do what's one pa? So back to the topic. Give us more of the reasons why. I think we have seen that traveling, no, whatever specialty out there, it wouldn't be counted here, especially US. So Cecilia Obi the person is making decisions, and I know from the comment section, a lot of people are saying that they wish they knew, they wish they knew. Please, if you have an experience you want to share with us, you can call in and then share it with us. Hey,
But Gloria,
KB with us.
Glory,
Maybe
yeah,
I
okay.
Make sure our experience, please come and share it with us. If you have any questions, to put it in the comment section or come on and come and share it with us. Please, we are streaming live on YouTube. It's an open to me on YouTube, Facebook as well. YouTube is RN Glory, Facebook is Glory Care. And then we are here on TikTok, K&A RN. Share, maybe more power tapping on not more share. These people are here. They are all nurses. They are spending their time here. One hour behind me, sure said, age in New York, and it's like New York, how many more wage you cry about $50 something?
Yes, more.
It's 1 hour, no, and it's like but she's here helping all of us. But I did show Massachusetts. Massachusetts means a minimum wage. And also about $50 something. So please, just tap a gift. Almost if you have the gift, share it to somebody. And
I'm the now bonda ko person ka bibi.
Bonda kasa okabi bio international nurse me bawa this one.
Okay.
I bonda kasa na yenti. Akwa abaso bonda.
Oh yeah, that more mommy. There's a 10 minutes me treat me make one.
Hey,
Asemuni.
Any o chima ko ni ye di ani
Asemuni.
the way Bondas was sorry, and you treat me we are fire for fire. international nurse. Akamaya,
Yeah.
yes.
Okay,
Ebu
so
tu ye ni a.
again, no, maybe some may added this to as I'm not say. And you say the can of ye discourage you be at Ghana. Obi be say make hay whilst the sun shines. It is a there's a school now be for ye critical no. Oba ha en sheda en boa but say ye the auto floor bit say yara unim near maybe any so to your benefit. Said the bear you don't look excuse me to say stupid in front of Free because no
Yeah,
came
me follow that. Anka me baby follow. I mean, sure.
piano.
Oh, me a mini pa. Hey, I didn't even see it. Thank you, thank you, thank you.
So abrofo no time bia no person looking down on us. It is our information ahead kakra na and also boa, right? Nti no. Though ye can say critical ni ade ade enye hwe wa ha. Yes, but
Uh, sorry, I was reading the comment. That's why I. So,
Yeah,
Freddie,
better.
you are back. You have given us some reason why. So, please, somebody is going to buy nursing forms tomorrow. Tomorrow is the start
Yeah.
of the nursing.
Meba.
And a lot of people that are anticipating to further their career in nursing are going to buy the forms. And we are doing this live because a lot of people have gone through difficulties achieving their dreams of traveling outside the country. And we are educating the younger ones, the things we didn't get the opportunity to know. And I know so everybody here is a nurse, was a nurse in Ghana, is here or have somehow been a nurse somewhere and is here in the diaspora. And to know, could tell us, Freddie has been giving us all the gist and everything we need to know. I know in my video, I gave a lot of reasons why you shouldn't do the specialities as the basic, but rather do the general nursing. Nti obi bi o dey ka ho please mo am joining ACC and the otwi ni moko no we let us know say we na we do doc no so we aha na yenye we yemfa international nurse I drop it. Manuel, you just joined us, so tell somebody why the person should choose general nursing and not midwifery, or just give a general advice on that topic. The way I dey akase ni no be say kura Friday. Manuel, are you there? And I say, "Usu uchimeko."
Oh, yeah, I'm here. I'm here.
And yeah, I feel now be gentle. I know you have sharp mouth like Pepe. You can say.
Oh, Pastor Manuel, you're born now. Kind of awesome. Yeah, Manuel. Yeah. So,
Yeah, so
Wait.
I think that there will be a kind of is true because me cry. No matter the so say midwife for mo the plan we here that be safe because there was school mo di jaya so so mo erase ko mo di 50 I see the come salary here so I wasn't even bothered about that one anyway. But as a recently, me started me videos kaka like all the comment section. What about midwife? What about midwife? So I look at my more disturbed and I realize that their pathways and now say if you go to most of the job portals and so on, um their their situation is very bad because I think the first is because they have only one session. They can only work in the maternity unit and the hospital is a big place. Two free maternity while all the other areas are nurses. And they don't even work in nursing homes or care homes because old people for no, they can't even give birth. So they are just limited and anything is difficult among. So if you have the chance or if you have the means and you are really passionate about midwifery, as the bosses have already said, just get the basics. Get your degree or um, diploma in nursing, and probably you can do your master's in midwifery. If
Hey, Emmanuel, phone then I will use you.
you
Hey, Ade, who Ghana na?
Oh, but I think it's fine. Oh,
I think it's doing che.
sir.
okay, and I've said it's easy. So.
Now we got Manuel's voice. You guys, I know him.
Oh,
Uh-huh.
Kafra. So, if I'm not to teach in the chance, then I mean,
Yeah,
chance.
yet say, but now a sound that was good enough. So you to us will be our one. Mr.
Okay, so
Am
yeah, so the mechano, I says with midwifery, no, they are only limited to the labor and the maternity and sometimes going out to do education. But if you take the nursing profession, even nurses can work in maternity units. Maybe they can call us if you go to the med surg, nurses, emergency, baby. So the midwifery area is a small unit, and the white abrofono, that is where their strength is. Ebinom, like Bruni B catch him say one reason in blacks will even come to the maternity unit is because some of them are racist and a racist never my life now you will be an okay. Ebinom omu yi
where the no one why.
mate ebi abrofo ni bi omu yi ni patuntum omu se ni patuntum be je omu awa omu mpe so because of their experiences in tea, even if the chance no was omu fa bibini no obey midwife omu be prefer broni mum
I know
and
you're
one thing is omu here be brave. You don't need a lot of midwives in a maternity unit. Unya kakra bi you are good to go. So once again we are admonishing and I say that's all sensitized. Say oh yeah, younger person now because school just get the basics and unless midwifery need it. Ebi a yɛhyɛ wo nkɔm maame nye mu ne yɛhyɛ no nkɔm sɛ ɔbɛwo bi ɔbɛyɛ midwifery ne kɛseɛ paa wɔ Ghana paa deɛ a main recommend mu bi at the moment. Yeah. So I think that for now, no, this is what I will say, and I will come back again with that.
okay.
Yes,
So
I
I
will
think
come there.
all our
Why?
talk. Obia come midwifery. What about public health nursing?
And Ukraine,
What about community health nursing? What about
I want the
nutrition? Yeah,
midwifery kwan ya kan say na community why. I want the no why kwan
community diploma there, you have a chance in UK, but public health nurse, you need baby having a chance there. So yeah, I don't know. So you guys should educate us more.
Public health nursing. I can the noise. I can see on authority say what CGFNS will put on your reports and they say omuni equivalent program in the US. No, that is true, and that is degree public health. And yeah, I'm not guessing. Oh, me will report when me phone to see bro. Why I try? I don't know.
Okay.
So why waste your time?
Okay.
Hmm.
That's it. So apart from
Eject your German for two, so mon count.
so I think even recently, someone was saying it in the comment section. Recently, mental health nurses they are facing it. They are facing it. The midwives are facing it, and it's not just US. Everywhere, oh. Everywhere. Just recently, Obi contacted me from UK. While trying the lines is a real. I'm friend say, ask you said the meaning what the midwives write. Where we so onye adwuma nyɛ. Even the general nursing are not getting work. How much more?
And
Um,
And Glory, general nurses are something you can. They have all the nursing homes. So say you can say when you're a hospital, you're nursing home.
Yes.
What? Yeah, what is a nursing home? You are a war. Yeah, war nursing home. They are both psychiatric nurses. Say most of over European
Rehabilitation.
rehabilitation. They have most several mental health issues. It doesn't like in Ghana like this. We also have mental health issues, but you pay attention to your mental health. But Hana, they pay attention to mental health. You know, background, kakra. That background will get you to work in a psych department. But you are working in a psych department as an RN or not as a psych nurse, prof or a RN who is designated to work in a psych department, but yes, psychiatric
Definitely.
nurse.
Yes, that's
He
very
doesn't
true.
earn money as a psychiatric trained. I'll probably also more psychiatric nurse. Maybe if they have a specialty that is something with psychiatry. Because at the end of the day, if it doesn't go along with the salary also earning, you don't have that specialty.
Basically, we are all writing NCLEX RN. So
Yeah.
there is nothing like you are going to earn anything for the specialty.
To for the specialty. There's a psych now, especially post diploma psych, no, as good as useless. Kimura, be
Do
careful.
you know one funny thing? I have another lady, Krana. She's not able to get her license because of the mental health nursing. She didn't get her license. It's become
Difficult
very tough
now.
for her. So please, those that are yet to start, don't. Your friend is a bonda. Would you make Korea? Let me know. Don't start and get stuck somewhere. What we are saying, no, and don't be angry with us. Who comment me the video na say some comments be anyway. But delete baby cry. Don't be angry with us. Say we are educating you. Hey, bia no na nka wo de wo koye and I say what catch the wo nua bi say onye no na efe wa be hu video ni no so onye na dem say wo fu. Don't be angry. We are telling you because some of your Ghana and Crawford took in as much as we thought we would travel, we didn't even know how. But and I told you, it is a quaint to all. Now I say Utuna because of your credentials does not match. Now there were a lot. Look, Freddie, there were a lot of people midwives almost green light and a choice and scenario, but they are not getting the visa for nursing certificate.
And the most painful thing is that to think of say you just made a wrong decision in picking a course keke. And I'm our brand is the most painful thing.
They've spent money, they've
Yes,
spent time, they've spent energy. Just imagine
and
going
and
to South
and
Africa to ride
and,
and
and currently boards in the US are accepting only like 4 boards.
it's not
And you
even
know,
up to four. Some of them are
obi,
even 50-50.
yes, and if you want to my just say, oh, board now, one nature, what for your endorsement, now why you there, and then have a brave Abranka, who take that decision now to do a diploma in general nursing or degree in general nursing as opposed to midwifery, and you would have smoothly sailed through this whole process.
Exactly.
Why do you want to put yourself through that stress for the future?
Exactly.
And it is not even for more school, even people or more. Year diploma nurses are afraid of person top up programs. Or more year nurses, current nurses in Ghana who want to go and do top up programs. Almost they should listen to the advice now. Yeah,
Yes.
money. And
Exactly.
PA because you say we doctor, when you doctor, yeah, ben
Hey,
doctor cry. The more beyond that down, then
Freddy, aseme Freddy.
almost
you see, AJ, Obia pepper Fred
And
pa.
then Freddy,
PAs ne anesthesia for ọmụ ba so ọmụ gị sọ ọmụ yẹ doctors so ọmụ yẹ doctors assistants ọmụ dị emi nimpo na ọmụ ba na ọmụ bẹ brọfo nursing so wọ Ghana no wayẹ akora na ọnim nti a.
AJ, I think someone peppered Fred with PA and as a critical care nursing.
There be me na me was many a doctor because me can't send the medicine or your UDS me no kun theater table so na patient da on. Oh yeah, me dey that's how they so. Oh yeah, me can't say UDS medicine out there guy.
Now you add a UDS medicine and your medicine.
I'm out
You
for
don't
contact
afford it.
medicine go when you guy UDS medicine out there. Me
Serious. BDS medicine is medicine as long as the
Oh,
person with medicine.
no, but I mean,
They okay, they oh yeah, Parker said. Yeah, you're for private university. Man, for your own, but okay.
no,
They go on
yes,
first.
sir. And yes, sir, but I mean, this was a very arrogant doctor who did the nurse attempts all your bathroom and all that. So, and I was the GRN president at that time. So,
Obi na
I,
abo do your comment section.
yeah,
No,
the people who know me know say me taking yama slightly, especially if you want to look down on nursing. Maybe you're one person and I be passionate about nursing. Oh, mommy. Up to now, I'm here. You see, because I'm call back, maybe I got a doctor, I'm a nurse, I might still choose the route of nursing.
okay.
That is how passionate I am about the profession. You know, Ubia now be nursing and in Tibia, and I mean, no, when you easy cry.
Can I please say something?
Yes,
Yeah.
okay, go ahead.
So I also want us to address the stigmatization of males going into nursing.
Oh,
You
I
know,
think we did earlier on, but since
oh
you brought it up, we can address
yeah,
it.
the obema the oyeness and abema oyeness imejuma and all like
Yes, they call Kena a
Me, I'm a brand antennas. Maybe I'm a
Martinez.
antennas no more friend me. And I,
ususi musika susi on musika.
oh, basically, now I'm about me dear move a pesca,
All right.
and
So on this note, the guys that are nurses, advise your guys that want to go into nursing. Because we have three guys here who are nurses, and they are living their lives.
Hey,
But
they
that
are
is
men
always
though, they are
celebrate.
men.
Hey, they are men, you men.
you can't say Bremen brand, and you're better with Isika.
Bema wa ho fe ni ubotomo, ni
I don't
ma
know
me
about
catch. Ho fe ni ubotom.
I say memo music and they don't do cho.
I know. Working see more, working see
So
more.
working.
Omo kasa bebre.
I won't catch a break.
Mm.
One I continue my continue.
Also, comment section, most oh, I'm saying we will do that. Anyway, so Freddie advise guys who want to get into nursing and even their own parents or their colleagues are teasing them and saying they're nursing, they are then after they're nursing, the other year. Those that are making that decision.
So I think I mean nursing primitive way of thinking is a nursing your bedside and nurse now or co-op. I mean several things are changing. Now if you go to practice and most of the people you see doing marvelous things in the health sector need be brain and nurses. So and you might think that me say one time you join you will be live now or mubusa questions. It was like me and I was trying to na my church and they were appreciating our kasaya and a doctor. Na me say me doctor baby. Me doctor and me fans them fan come doctors. Na enko yet is the nurses the omu nyim. I'm a nurse and I'm an informed knowledgeable nurse. What did the make can I say? So I just want to build on the point say there are several people you go to hospitals and you see them, they are doing great things. Obeko theater, maybe one more go up and down, on a baby, you think so, or a doctor or a anesthetist or a nurse. Or a nurse. Kakrebi you might find them and only say there are men in the profession who are doing great. There are top hierarchy members in the profession, they started as nurses, they are still nurses. Once a nurse, always a nurse, no matter wherever you find yourself. We have people in academia, they started as basic nurses. So do not feel shy. Me call Accra Academy. Those of you who are Accra, you know how Accra Academy, yeah, boys school or more bragging is any man. My class, I would say, me na me male nurse. Me batch, me 2006, me pa na me nursing. So you would understand that people look down on nursing at that time, but nursing has made us who we are today, and then it continues to make so many people. There are several people you find great unlock with NKA or a nurse, Papa nurse, and there are several people, opinion leaders, people even in politics are they started as nurses. So don't feel down, say a ma professional or join. I can say that currently, Krano, the percentages of males to females in the nursing schools and our nursing profession, no, and yet that bad. Now, I can say the men could even make like 30 or 35% of the nursing population in Ghana now.
I can say they are even about 50.
Yeah,
Yeah,
because I remember you call Barbados out of the recruitment. Normally call Barbados out of there 120 nurses. No, almost 50 to 60 were male nurses.
Wow.
Were male nurses, and if you look at people that are traveling, here podcast, here, majority of them are male nurses. So you are not the only one left out. And nursing provides you the opportunity, it gives you secure job for the future, it gives you avenues. You come and do a profession, you come and do a job that pays you well, that makes you who you want to be. And you know, say nursing, don't feel stigmatized. There are people who are called unlock with kweku. Uko ni page and when you check a video, see the akoche o ma me ko na da chen say, "Oh akwa won ka no the no nurse or a male nurse." What you say? You find like people come and no page. You see wonderful page. It was all call holidays on and Finland the two baby.
And I'm
Watch a video.
saved.
What the extra video? Aha, no one in Barcelona come now. They are coaching on my matches. This is why I see myself in the next 10 years. He started as a male nurse. I want to be a male nurse because I am more profitable to do male nursing than to go to university and do psychology, sociology, logi. Now we are now. What is all my saying is come out. Now, my this was saying is come out and sana. Did know. So I mean, I'll leave it for people to also give
Yeah.
comments.
The guys, the men, this question is to you, to more answer. What are you telling the guys that want to go into nursing? Manuel. Manuel, what was saying? You can't about what was saying. Your friend is say, Bonda. Bonda, where did you live? Manuel Casamaya, Bonda, Bow, you.
Oh, I think
Thank you for the
nursing
question.
has always been very interesting, and I come from a family of nurse. Apart from my father and my mommy, Omo can be a mini nurse. So it was easy for me to get into nursing school, and it was easy for me to sail through. And it's a very rewarding career. I said the senior man kind of workers. Your time now is very simple. Who is Kuma? You be paid. You are able to steal, and it was very easy. And I enjoyed all these benefits. So even now they don't push people automatically. There's still avenue for you to travel outside. I always say, nursing is the only profession now you can take your passport and in so this Caribbean. You can travel all over the world. That's what I say, because everything else is happening in the world. Finland, ICN Congress or US basic. Like, and if you are a nurse and you are a learner, you can go to all these places and you can create something for yourself with all these opportunities. And let me say the last thing. And the person that I look up to is now no, he's a doctor in nurse because anesthesia and Freddy is super anesthesia for.
What the
Yeah.
anesthesia about UK? Oh,
What's it?
anesthesia no in UK na.
No, that be me. When I make a story, no. So I
What
went
say?
to anesthesia. We were first year, no. Like